Thank you for joining us. I'm Dr. Christine Nefsi, and I'd like to welcome you to the Munson Healthcare Weekly Press Conference. We are joined today by several of our health department colleagues. Wendy Hirschenberger from the Grand Traverse County Health Department, Lisa Peacock from the Benzie Leelanau Health Department and Health Department of Northwest Michigan, Jennifer Morse, the Medical Director for District Health Department 10, Heidi Britton, the Chief Executive Officer of Northwest Michigan Health Services. And Diane is unfortunately having some technical issues. I'm sure she's listening, but we're going to just go ahead and have me lead it off for this morning. So thank you. Starting with our numbers, we have seen a slow but steady increase in the numbers in North Michigan here over the last week or so. We are currently at a 4.2% positivity rate and have 196 cases per 100,000, which is up from last week. You can see there are cumulative cases over the past year. Next slide. We currently actually have 27 patients hospitalized across the Munson Healthcare system with COVID-19. Again, that is an increase over what we saw last week. As our numbers have increased in the community, we have seen a follow increase in the number of patients hospitalized. Next slide. You can see there, certainly we are at a much lower level than we were in the December, January timeframe, but we are seeing an increase after seeing a welcomed decline. Next slide. So to give an update on the vaccines, we wrap up our second dose clinics for Munson Healthcare on March 11th. Our community members that do still need a vaccine and qualify a vaccine are invited to please call their local health department. You can also call several of the pharmacies around the region, around your community. Many of them are offering vaccine as well. If you are a veteran, that is also an option to you if you are over the age of 75. And just as a reminder, Munson Healthcare is no longer scheduling any first or second dose vaccines. If you are due to get your second vaccine from us at Munson Healthcare, you should have already had that scheduled. Next slide. To date, we as a healthcare system have administered over 34,000 vaccines, and we are just over 66% of our Munson Healthcare staff and providers vaccinated. Thanks. I'm sure many of you have been hearing about the new variants that are around. We have seen several of the new variants here in northern Michigan. We are concerned that those new mutations are more contagious. And so it's very, very important that we continue to stay the course and slow the spread. So please, when you are in public, outside of your home, wear a mask. Please stay 6 feet apart. Avoid any indoor gatherings. If you do have symptoms, please get tested. And once you are eligible, we strongly encourage you to get the vaccine as soon as it is available to you. Again, those variants do appear to be more transmissible. There is some preliminary data that shows they may be less responsive to some vaccines. So it's very important that we avoid exposure. And again, important that we understand that the more virus that's out there, the more opportunity it has to mutate. So continuing to quarantine when you're sick and really do everything you can in your power to prevent the spread of COVID-19 continues to be of utmost importance. Next slide. There are some rules that have changed specifically about visitation to long-term care facilities. New long-term care residents must continue the quarantine for 14 days upon arrival. And so while they're in that quarantine, they may not receive visitors. However, if they are already residents, they can allow visitations. So if you are free of any COVID-19 positive cases, visitation is open. The visits are limited to 2 or fewer people for every resident at any given time. Indoor or outdoor visits are permissible, and they are subject to reasonable time limits. Every use of technology, so iPads and FaceTime and those kinds of technologies do continue to be used to connect residents with loved ones if they are in a situation where visitation cannot occur. But I know for many of those residents and their families, the opening up of that possibility of visitation is a welcome one. Next slide. If you are going to visit a long-term care facility, it's important that you make an appointment. You must provide proof of a negative COVID-19 test within the last 3 days or agree to an on-the-spot rapid test at that facility. You will be asked some health screening questions before you are allowed in, just like you are at any of our hospitals or clinics. And you must complete a visitor's log upon arrival so that if there is a need for contact tracing, those long-term care facilities have a way to get in touch with you. Additionally, just like at our hospitals and clinics, you will be required to wear a mask and follow hand hygiene requirements, practice social distancing, and adhere to whatever that facility's PPE requirements are. Next. These are numbers for information for those long-term care facilities that are owned by Munson Healthcare, and you can please contact them specifically for more information. Next slide. In addition to our long-term care, the Munson Healthcare facilities visitor policy was also updated. For COVID-19 positive patients, we are allowing some visitation. There is a time limit, however, and it is at the discretion of the patient's care team. For end-of-life patients, if they do not have COVID-19, they may have up to 4 visitors at a time. If they are COVID-19 positive, they are allowed 1 visitor at a time, 2 for the day, and those all the appropriate personal protective equipment for that must be worn. That visitor policy is on our website, along with a lot of other information about COVID-19 specifically. Next slide. As a reminder, you will be required to wear a Munson Healthcare issued mask if you come into any of our facilities. You must pass the current health screening questions. Just like at the long-term care facility, you will be required to provide your name and phone number for contact tracing purposes. We do ask you go directly to and from the patient's room you are visiting or to and from their appointment and not walk around the hospital more broadly or the clinic. If you wash your hands, you must wash them using soap or water or alcohol sanitizer before and after leaving the room, as well as the facility. And please understand that we do have some areas where there are additional restrictions in place due to vulnerable patient populations or limitations in our ability to appropriately social distance. Next slide. I'm going to turn it over now to our health departments, and we're going to start with Wendy Hirschenberger from the Grand Traverse County Health Department. Wendy.
Good morning. So last week there were some changes in our region with expansion of eligibility for who could get vaccinated. This was something that was done in regions 6 and 8. So I'm just going to go through for Grand Traverse County what that meant. So for last week, we started vaccinating anyone who was part of that essential worker group that is in phase 1B. So that was the last group. That includes food and agriculture workers, utility or critical manufacturing workers, public transit workers, deliveries, grocery store workers, U.S. postal workers, and others who have a unique skill set, such as those in non-hospital laboratories, veterinarians, things like that. And then starting this Monday, we have an additional group who are also eligible according to state guidelines, and this is statewide, and that is those who are 50 or over that have medical conditions or disabilities, and then caregiver, family members, and guardians of those who care for children or adults with special health care needs. There are definitions out on the state website, as well as some other places that go into more detail. We at the health department here have a very high vaccination rate currently with our 65 plus population. It's actually the highest in the state. And because we have such a high current rate, we needed to expand who was eligible. So that doesn't mean that we are forgetting about those who are still in that 65 plus group who still may need to be vaccinated or homebound. So we will continue to vaccinate that group, and we are working with several community partners locally, including Area Agency on Aging, Commission on Aging, Senior Center, United Way, and the PACE. So if you know of anybody who falls into that group, please call one of those organizations, and we will continue to make sure that this high-risk group gets vaccinated. As Dr. Nefsi described, we are continuing to see a bit of an increase with cases right now. In Grand Traverse County, we are seeing clusters that are related to social gatherings, particularly social gatherings outside of school, like sleepovers and other types of parties. We are seeing clusters in work sites. But the clusters that we're seeing within the schools are not due to school related activities or exposure in the schools. So we do want to make that clear. It's just as important as ever that people continue to screen prior to going to work or prior to going to school for any symptoms, that they get tested if they have any symptoms. We're still testing at our Cherryland testing site on Mondays and Tuesdays. If you go to our website, you can easily sign up for a test there. And it's also important that people continue the key mitigation effort requirements of wearing masks and social distancing. That's all still very important. As far as vaccination distribution for Grand Traverse County Health Department, this week we will administer nearly 2,000 first doses and 565 second doses. At our clinic right now, it's currently all Pfizer vaccine, and we will also be administering another 300 doses of the Johnson & Johnson to one of the specific targeted populations. The cumulative number of vaccine doses that Grand Traverse County Health Department has given through our vaccine clinics through the end of last Friday is 19,074 total doses. So I think I will stop there, other than to say that we continue to work on our process for scheduling vaccines. We are in the midst of a upgrade to the screening software. It's not fully integrated yet, but right now, if you do go to our vaccine site, you are able to register if you are eligible. Appointments for this week were filled by people who were previously in the queue from the previous week, but as we have more appointments, we will then be emailing people out a link so that they can then go back in and get appointments that way. So there will no longer be visible appointments on the link. It'll be all automated through that process. I think I'll stop there.
Great, thank you, Wendy. I'm Diane Mihalik, Chief Marketing and Corporate Communications Officer with Munson Healthcare. I was having some technical issues in the beginning of this webinar, so I apologize, and I thank Dr. Nefsi for kicking off this press conference for us. So thanks, Dr. Nefsi, and thanks, Wendy. And next, I'd like to introduce Lisa Peacock, who is the Health Officer for the Benzie Leelanau District Health Department and Health Department of Northwest Michigan. Welcome back, Lisa.
Thanks, Diane. I appreciate being here. So I have updates that are somewhat similar to what Wendy presented. We're working on a lot of the same things in public health for sure. But so just a brief recap, we are seeing an uptick really in the pandemic risk across the northern region in many, many counties. And so, you know, again, clusters and outbreaks mainly related to sports and gatherings, but certainly situations that impact the school population. So we're watching that very carefully, and we really do want to remember to make sure that everybody remembers to stay safe out there, continue masking, continue hand sanitizer, continue keeping our distance from each other, and just being really careful. We're not out of the woods yet. We're working hard at getting the community vaccinated, but certainly these outbreaks remind us, and the rising hospitalizations remind us of how serious that this continues to be. We have also, in both of my health departments, implemented some new and improved software for managing the pre-registration list. So that process has had some great improvements in the last couple of days. We can now sort more easily by the priority groups, which has been really great. We are able to communicate with the people on our list in a more efficient way. And so we look forward to that process being a little smoother going forward. We, along with our partner health departments across Northern Michigan, have also expanded eligibility in both of my districts. We are welcoming anyone 50 and over to get registered to be in the queue for scheduling for their vaccine. We also opened up opportunity to the rest of the priority 1B group C frontline essential workers. And I won't list those off. Wendy did a great job of sharing who those people are. And we also are continuing to prioritize the 65 and over population. In the Northwest District, we have about 61.5% of the 65 and over population who have received at least one dose or have initiated the vaccine coverage. And then in the Benzie Leelanau population, we have about mid 50s, so 53% of the 65 and over population who has started their vaccination series. So those are really encouraging numbers we are getting there. We are also continuing to use multiple strategies to reach seniors and to reach adults with underlying conditions and people who are caregivers and any of our vulnerable populations. We've done some key informant interviews with select populations to just better understand their perspective, as well as done an assessment across the jurisdictions of the Social Vulnerability Index to determine where our high risk areas are and how can we best serve the people who live and work in those areas. We are looking forward to having the first allocations of the Johnson & Johnson single dose vaccine. We received our first allocations last week, and this single dose vaccine that can be stored at refrigerated temperatures definitely offers more flexibility in reaching those vulnerable populations. So in my districts, we have initially worked with some of our smaller hometown pharmacies to be able to do some distribution to them. These are entities that have not yet been able to have access to the vaccine and have waiting lists of people 65 and over that are waiting to get vaccinated. So we are really excited to be able to share some of that with them. And then looking at again, our high SBI areas where we can go out with some strike teams with the help of the National Guard to get those people access to a vaccination that might not be able to attend one of our traditional clinics and meet their needs in a different way. So people can, again, visit our website to complete the online form. It probably looks the same to most, but it is a more efficient process behind the scenes. So we encourage people to get in that scheduling queue. This week in the Northwest District, we are planning on administering 3,990 doses of a vaccine, and we have given just over 20,000 in that district so far. So that's great progress. And in the Benzie Leelanau district, we've given just about 6,500 doses, and we plan to administer 1,052 doses this week. So I will stop there and pass it back to Diane.
That's great. Thank you, Lisa. Next, I'd like to introduce Dr. Jennifer Morse, who is the Medical Director of District Health Department number 10. Welcome back, Dr. Morse.
Hi. Well, first, I want to say happy anniversary, because tomorrow is the 1-year anniversary of when our first cases were announced in Michigan. So it's been a long year. And I want to echo everyone else's concerns that we really are at a tipping point. I think we're headed for another spike, probably mid-April, if we're not cautious with the different variants, increased gatherings and travel that we're seeing. And so just remember, just because something might be allowed doesn't necessarily mean that it's safe. So let's, just be really cautious, because we don't want to end up having to tighten restrictions again. So I'll just echo everyone else's comments. So we did also follow suit and are opening up our vaccinations to everyone over 50, at 50 or over, regardless of medical conditions. The same frontline essential workers are also open to be vaccinated at this point, and the caregivers to individuals with special needs are also open to be vaccinated in our 10 counties. We are planning larger clinics throughout our district, and those are being organized at this time. We have provided nearly 40,000 vaccines at this point and continue to do so throughout our 10 counties. Just one other thing wanted to mention, we've had just a few reports in one of our counties from citizens that someone had gone door to door offering to sell them a vaccine in the name of the health department. And we just want to remind people that unfortunately there are people that are utilizing this pandemic as a means to scam and to do other fraudulent activity. The local health department, the state health department will never try to sell you anything, will not do anything like that. And so if you ever are offered a vaccine for money or for other products or anything like that, know that it is not a legitimate thing. It is not through the health department. And if you have any questions, you can call us or you can email. We have an email that's covid@dhed10.org. So we just wanted to, again, remind people that unfortunately things like that are happening. You can sign up for vaccinations at our website, the dhed10.org/COVID-19-vaccine. If they are full, just continue to keep checking. And again, if you have any issues with internet access or technology, you can contact 211 or those other numbers that were listed earlier. So I think that is the end of my update.
Great. Thank you, Dr. Morse. We'll have you back as a panelist for the Q&A in just a minute. And last but not least, I'd like to welcome back Heidi Britton, who is the CEO of Northwest Michigan Health Services. Welcome back, Heidi.
Thank you. NMHSI, I'd like to announce, has finally received our first allocations of the COVID vaccines this week and are already beginning to schedule our patients as well as all other approved priority groups, as the other health departments have noted. We received only 200. We look forward to getting at least 200 to 300 every week from here moving forward so that we have a constant supply and we can start building out a nice schedule that is consistently being staffed every week and vaccines to be delivered. NMHSI has also been awarded 1,000 vaccines to be delivered through a community outreach COVID-19 vaccine pilot program from the Michigan Department of Health and Human Services. The goal of the pilot program is to help remove barriers to vaccine access for Michiganders 60 and older who live in communities with high social vulnerability index and a high COVID-19 mortality rates. So we'll be delivering these vaccines in Oceana, Mason, Manistee, and Benzie County over the next couple of weeks. They will be through our mobile vaccination clinics of about 200 persons at each of the clinics, tentatively scheduled in Shelby, at some churches, at an agency on area agency on aging for Oceana, an Armory Youth Project there in Manistee. And so as we lift those sites up and we partner with our community partners to get them scheduled, more information will be pushed out at that point. The social vulnerability index is really how these were awarded, looking at census tracts, and the SVI is a tool that uses census data to identify places where a community may have more difficulty preventing human suffering and financial loss in a disaster. It assesses the extent that 15 known indicators are present within a community based on socioeconomic status, family composition, and disability, minority status and language, housing, and transportation. So we're pretty excited about this opportunity, and we're excited to get 1,000 vaccines out over the next 2 weeks. Also, we're working in concert with MDAR, which is the Michigan Department of Agricultural Resources, for the migrant agricultural workers. All farmers with housing can contact their local IMDAR representative to assist with scheduling, as well as working directly with their local health departments. This partnership is truly with ourselves, IMDAR, the local health departments, to get the vaccines to this specific group. And then lastly, as Northwest Michigan Health Services is getting in the game of vaccines and the delivery of it, we're preparing our website to have a link. So for ease of scheduling and getting as many vaccines in arms as we can. So more to come hopefully next week. We'll push it off to the press conference next week to make sure that link gets there and get this pushed out to the community so they know where to go. Thank you.
That's great. Thank you, Heidi. And I know some of that was breaking news on the 1,000 vaccines awarded. So that's really great news for our community and for Northern Michigan. All right, that wraps up the panelist presentations. I'd like to bring all of our panelists back for a Q&A session. So the first question we have, and as a reminder, if you'd like to ask a question, if you are actually logged onto the Zoom call, you can use the Q&A feature. Otherwise, please submit your questions through our Facebook feed, and they will definitely reach me, and we'll try to get to as many questions as possible. So the first question is for Dr. Nefsi, and the question is pretty simple. Are we in the third wave right now, the third surge?
It's a good question. I'd say, looking into my crystal ball, it certainly appears that we are seeing the start of one. I think most of us on this call are worried, not only with the clusters we're seeing and the new variants and spring break coming, that it's kind of a perfect storm to lead to that surge. I would say, though, that, there's always an element of control in our actions. So if we continue to mask and social distance and stay safe, we absolutely have the ability to flatten that curve and mitigate the consequences.
Great. Thank you for that answer. I have one more question for you as well. Could you explain a little bit more about why Munson Healthcare is not scheduling any new first dose vaccination appointments?
Yeah, we just simply aren't getting the vaccine in order to do so. What we've found is that just like when we do flu shots and other things, typically we might do, an initial big surge. And when we were vaccinating our own employees and getting lots of vaccine, that made sense. Now, what is making sense is the amount of vaccine that we're getting is to allocate that to our regional health departments and support their mass vaccination clinics, and allocate it to our primary care offices, who really are typically the ones who know the patients best, and just like with the flu shot, have the ability to get large amounts of vaccine into arms. So that's why we just aren't getting it. And from an efficiency perspective, it makes sense for us to have adjusted as we have.
Great, thank you. The next question I'm going to ask Lisa Peacock to address. Lisa, are you still there?
Yes, I am.
Oh, you are. Okay. You had mentioned that you are now, have the Johnson & Johnson vaccine. Can people choose which vaccine they receive, or they?
No, typically not. The allocations are unpredictable enough that we can't plan for. We don't have them all at every clinic situation. But I can tell you that our typical pattern is that we use Moderna or Pfizer in our mass clinics, and have been this entire time. And so we've never been able to offer a choice between those two vaccines. We do get questions and field those questions, no problem. The Johnson vaccine, being a single dose and being able to be stored at refrigerated temperatures, lends itself to some additional strategies. So we'll be using that vaccine in a little different way other than our mass clinics. Like I said, redistributing to some of our pharmacy partners who have not yet been able to start vaccinating, as well as some of the community approaches we use through strike teams and just trying to use that vaccine for a population that might have difficulty getting that second dose. So in general, the short answer is no.
Great, thank you, Lisa. I'm going to ask Dr. Morse to address this next question. It's from one of our reporters who's listening in. And the question is, it looks like 2 counties in District Health Department 10 have been at the top of the state's data on testing positivity rates for the last 2 weeks. This week, more than 10% of tests in Missaukee County came back positive. Last week, more than 10% of tests in Kalkaska County were positive. What do we know about why that's happening, and how concerned are you about that?
I would have to talk to our communicable disease coordinator to find that out, but I know for those 2 counties, I know they have a low population, and I know in the past we've had times where testing initiatives, whether it's in the nursing homes, AFCs, other areas, if you do a large amount of testing and you get, several positives reported, it can really tip the scale. So, again, I'd have to follow up with my communicable disease coordinator. Unfortunately, with 19 counties, I have a hard time keeping track of each one of them. But again, typically with those small counties, it doesn't take much to tip it from 5% to 10%. And if you look at the total number of tests done, for a lot of them, it's only 20 to 30 tests a day. So that data is available on the mystartmap.info website. And again, it just doesn't take much to tip it dramatically. So if they want further information, they can contact our PIO and get that information.
Great, thank you, Dr. Morse. This next question I'm going to ask Dr. Nefsi to address. You were recently, we were talking about the recent spike. Is it still fair to say we are trending downward to levels not seen in 5 to 6 months, or is this spike a new trend upward?
Well, I think that's related to, to that first question. We don't know yet. I mean, we've been tracking this for about a week or so. So right now it looks to be a trend up. If you look at the data points, I mean, it's been pretty consistent over the last week or so. It really remains to be seen. And like I said, this is not out of our control. So certainly we would encourage people who have symptoms to get tested, and we would continue to encourage with the variants people to be careful out in public and even with their friends and loved ones to make sure that they are taking every precaution necessary. The answer is I don't know at this point, but certainly it appears that this is a slow trend up.
Great, thank you, Dr. Nefsi. Heidi, we have a question coming in from one of our reporters regarding the 1,000 doses for the pilot project. Will those be available for scheduling, or do you have targeted groups that you will actually be reaching out to?
It will be a combination. So absolutely for scheduling for the public to be able to get in there and schedule in those areas, as well as if we can't fill up the clinics, we'll be targeting some groups and making sure that it happens. So both. There's no special key to it. It's just the area that we'll be in to provide the clinic. And so that's the whole purpose of the pilot program, is to put the clinics in a space to reduce those barriers such as transportation, language barriers. We'll have bilingual staff out there. We'll address the needs of that community and anyone surrounding it to make sure that they have availability to the vaccine.
Great, thank you. The next question is, it's addressed to all of the health departments. So I'll try to see whose face I can read, who wants to take this one. For the health departments, as we open up to 50 and over for vaccine on March 22nd, will you be sorting the sign-up list based on age? Lisa, I know you said that you had you mentioned your scheduling system and how you were able to sort now, but how actually will you be using that?
Yeah, so we are currently inviting everyone 50 and over to get in the queue for scheduling. So in our smaller areas, it is more difficult to separate out those who have underlying conditions from those who don't, and still have enough people to hold several clinics every week. And so because of that, we didn't want to create barriers for ourselves. We opened it up to that entire 50 and over population. We are sorting. When people pre-register, they self-select into one of the categories that are aligned with the current eligibility groups. And so you will be able to say, I have an underlying condition, or this is my age. And so we do collect that information so that we're able to sort that pre-registration list so that we can keep a balance. We're still asked to focus 75% of our vaccine allocations on the 65 and over group until they are, fully covered. And that's our highest risk group. And so we are still trying to find that balance and prioritize accordingly. So yes, we do have that information.
Great. Thank you, Lisa. This next question I'm going to ask Wendy to address. Wendy, the question is, what are some of the changes in either healthcare systems or public health agencies that you see lasting beyond the pandemic? What's changed over the last year that's going to stick around more permanently? So I'm going to ask Wendy to address that, and then I'm also going to ask Dr. Nefsi to address it from a Munson Healthcare perspective. But Wendy?
That's an excellent question. A little bit hard to predict, but certainly as we've gone through this pandemic, I think we all have seen things and wondered. I wonder if this is going to stick around. I imagine that there will continue to be more use of technology for meetings, particularly when you're having people come from multiple locations, just for efficiency. As we're able to do that. And I imagine there's some level of health department services we hopefully will be able to continue to do virtually. Certainly there are certain circumstances where that seems warranted, and just the overall implementation of safety precautions, washing hands and sanitizing, and likely moving forward, we might see people frequently wearing masks during flu season. We've had an exceptionally low, almost non-existent flu season because of all the mitigation efforts. So that would be my answer for right now.
Thank you, Wendy. Dr. Nefsi, do you have any comments on that?
Yeah, I think that's right. I think we did learn a lot about some of those mitigation strategies. There's some good studies. I mean, I can remember at the beginning of this, trying to find data on mask wearing and the efficacy of mask wearing, and it just didn't exist. So now we have a lot of that data. So I think that some of those epidemiological, those mitigation strategies that we hear from our epidemiologists about social distancing and masking will definitely come into place much more quickly when we see whether it's influenza or, a COVID virus, whatever the virus or infectious disease is that we're dealing with. I think we'll see some of those things come in much faster, and I hope be more supported from a public health perspective. I think the virtual care will not change. Our ability to see patients virtually for whatever reason, whether it's because there's a pandemic or bad weather or they just don't have access to transportation. I think that we've really made huge strides in developing or adopting that technology within Munson Healthcare. And so I don't see that changing at all. And I'd say we learned a lot. I mean, you can just see from this press conference and the coordination we've had with our health departments and other healthcare entities across our region, that communication and coordination has been, I think, a huge benefit to us in Northern Michigan. And I think that, I'll speak for all of us here that we have learned the lesson very clearly about how important it is to have that communication early, ongoing, frequently, and involve as many stakeholders as we can, whether it's our schools or local governments or whomever. So I'd say none of those things, I hope none of those things change.
Thanks, Dr. Nefsi. And Heidi, I wanted to let you have an opportunity to address that as well. Do you see anything changing permanently or big changes to your area moving forward? Any lessons learned from the pandemic?
Obviously, like Dr. Nefsi always says, her crystal ball that she brings out, she actually threw it through the screen at me. And I would just say perhaps, I would love to see telehealth continue. I think that's a bigger issue, but it would be really amazing. The telehealth for behavioral health has been a godsend for lots of folks. I think telehealth for medical and keeping our folks who really feel awful from having to get into a car or a bus to drive to their doctor's appointment just to find out they're really sick would be great, right? So telehealth is key. I think it's transformed healthcare. I think it's transformed the delivery of healthcare that we give. I love the curbside stuff. I love being able to go in that we've really repurposed ourselves and become extremely resourceful in ways that sometimes healthcare feels like a big, big machine that's moving through that is not so nimble. But we've proved that wrong. We are nimble. We did make we pivoted all over the place, and I think we've pivoted for the best. And I just see that even just keeping the flu out this year has been extremely exciting. And I know myself is super excited that I didn't get sick this winter. This is great, right? So like the cleaning procedures that we put into place, I hope we all keep that in the schools, in healthcare, in telehealth, in nimbleness, in pivoting, and the challenges that we had, we all rose to that occasion. And I think that's to be highlighted. And I think that hopefully gets continued to be advocated for healthcare, that they continue to be able to use some of these really great best practices.
Very well said. Thank you, Heidi. And I agree with all of what you said. Dr. Morse, we have a couple of questions coming in that I think you're the appropriate person to address. So as the age of people who are eligible to get vaccinated drops, how are you preparing to vaccinate folks who are still working and may struggle to get to a clinic?
We do have Saturday clinics almost every single week. And as we get the bigger, more centralized clinics, I think that will help. As was mentioned earlier, there are numerous pharmacies that now have the vaccine, and that's growing. And that's coordinated at a federal level. So that comes right off the top. The federal government ships that right to Meyer and Rite Aid. And in the UP, the Cardinal Pharmacy System. And then we do have, in one of my other districts, there's more coordination with the pharmacy system where they're actually delegating some of their vaccine to pharmacies. So, they have more lenient hours. And then when we're dealing with our essential workers, like it started with our teachers, we'd actually go to the teachers and vaccinate them when their workday was done. And same with our agricultural people right now. We have numerous clinics set up where we're going to those farmers, to those packaging centers to vaccinate them on the job site. So, if there's a large number of individuals, it's usually smarter for us to go to them than to make them try to all come to us. So, we understand that people don't work, for them to have to come off of work is challenging. We also tend to have at least a few clinics a month that start a little later and go a little later. So it might be 9 to 6 instead of 8 to 5. So we do try very hard to keep those things. Of my 3 districts, District Health Department number 10 has been the most conscientious about that with everything they do, whether it's family planning, WIC, or now with vaccination clinics. Very, very aware of that.
Great. Thank you, Dr. Morse. And one additional question for you. Are we seeing an uptick in school COVID-19 cases?
I don't have a tally of every single case that I have, but I've certainly been getting a lot more calls from schools and from my nurses about school cases. Unfortunately, the fear I had was, a lot of them are athletic related. I have a decent sized outbreak in a county in another health department. So we don't see a lot of spread within schools, but as our community incident increases, they catch it in the community and then they go to school. And then we have to deal with the repercussions in the school. But, the current outbreak I've had recently has been related to sports activity. So, again, I would say, honestly, it's about the same as it has been. If not better, because it's not November anymore when cases were really, really high. So, but we're all really fearful about mid-April when everyone's come back from spring break. So we're getting a lot of questions from superintendents and principals regarding our recommendations of what to do with travelers, because there is a lot of concern and fear about that.
Thank you, Dr. Morse. And one last question for Dr. Nefsi, because we are out of time, unfortunately. But the last question is, do you know if we will need a booster shot?
We don't have that information yet, but many of the manufacturers of vaccines are actively looking at that and doing studies to see not only how long natural immunity, but also vaccine-induced immunity lasts, and looking at whether adjustments need to be made based on the variants for a booster that way as well. So we don't have that information yet, but there are lots of studies, lots of work going on to determine that.
Great. Thank you, Dr. Nefsi, and thank you, Dr. Morse and Lisa and Wendy and Heidi for joining us today. I'm going to have the slides brought back up because we do have just a couple of reminder slides at the end here that I want to make sure we get to. So again, thank you to all of our panelists. This information that you're seeing right now on community resources will be available on the munsonhealthcare.org website as well. This is all the information summarized that Heidi and the health departments have mentioned earlier in the presentation. Next slide, please. And as a reminder as well, we invite you to stay connected with Munson Healthcare. You can sign up for our e-newsletter at munsonhealthcare.org/newsletter. That goes out about every 2 weeks and has all the latest COVID-19 information as well as additional information on what's happening and what's new with Munson Healthcare. We invite you to follow us on Facebook, LinkedIn, Instagram, Twitter, and YouTube. And again, check our website for the latest updates on COVID-19, whether or not that is our visitation policies or current FAQs on topics that are trending that you're hearing about in the news. So again, thank you everyone, and we will plan to have another press conference next week and hopefully have all of these guests back in 2 weeks for another update. So thanks everyone and have a great day.